surprise that an increasing number of people would rather die at home, surrounded by family, than in a hospital bed. At any given time, the provincial agency that oversees home care is responsible for looking after 1,300 dying people in this region. Well, this morning, one of those people, 78-year-old Rose Steenbakers, passed away from cancer. Last week, while she was gravely ill but still able to talk, Steenbakers agreed to share her story with CBC about the declining level of support for the dying in the Ottawa area. Simon Gardner joins us now live. So, Simon, how did you meet Rose Steenbakers?
I was introduced to Rose by a palliative care physician, Lucy, who is concerned about dying people being put onto waiting lists, not for medical care, but for help, say, bathing, getting dressed, making meals, going to the bathroom, you name it. At the time I saw Rose, her body was failing fast, but her mind was still sharp. She told me she agreed to share her story with the hope it will save others from the same fate she and her family have experienced over the past several months.
So every patient that requires palliative care, newly requires palliative care, is going to be put on a wait list.
This is Paul Hacker, a palliative care doctor who makes house calls. He's raising alarms about the declining level of support for people who want to die at home. People such as Rose Steenbakers, a 78-year-old I'm about to meet.
Hello.
Hi.
Please come in.
Just take a listen to your breathing.
In September, she was diagnosed with lung cancer. It's spread to her brain and liver. She has sores in her mouth and finds chewing gum helps. She gets regular visits from Hacker and nurses, but what the family could really use is more help from what's known as a personal support worker.
And so right now you get a personal support worker for 1 hour a week?
Yeah.
That's it.
Well, to come in and shower her?
Or to do whatever.
That's all they're coming, yeah. Just to come in and shower her, now it's just once a week.
For months, Steenbaker's adult children have been looking after her personal needs. It's become more than a full-time job.
We have to lift her out of bed. And we have to stay right behind her because she could fall. We have to lift her off and on the toilet. Sometimes we have to help her with her personal needs on the toilet because she's sometimes just too weak or too tired to do it. For her, it's really embarrassing and she loses her dignity.
Another sister who declined to be interviewed moved in with her mother, but after months of 16-hour days, came close to having a nervous breakdown.
I've come here at 10 o'clock at night on more than one occasion because she's breaking down because she's exhausted. She's just exhausted.
And these girls are straining their backs trying to lug me around, and it's, I need somebody that's a little heavier, a little bit.
The sad reality is that Rose happens to be dying at a time when the provincial budget for home care in the Ottawa region is running out faster than expected. That's why even dying people are on waiting lists for personal support workers. Are you surprised that you're not getting more help from the provincial healthcare system?
Yes, I am. Yes. I think they could step up and to the plate and do a little bit more.
Dr. Hacker says many of his patients are in the same situation. He recently wrote a scathing critique called Champlain CCAC Rations Patients' Personal Care in Their Dying Days.
The government has been focusing on trying to get care out of the expensive hospitals and into the community where costs are less, where patients want to be, and where there's more support for them. But unfortunately, the funding hasn't followed the patient.
To get answers, I sat down with Mark Sugavinsky, the CEO of the provincially funded Community Care Access Centre, better known as CCAC.
We are striving to do more, but we have limited capacity. That's a reality.
He blames the limited capacity on an unexpectedly high patient caseload, especially in June when more than 5,000 people needed home care services. That, he says, is why they're running out of money and having to put people on waiting lists for personal support workers.
It's a tough situation, and we all know people who have been through that.
He adds that the wait listing will last until next April when the province gives CCAC another block of funding. That doesn't help Rose Steenbakers, but she agreed to speak with me because she thinks her story may help others.
My motivation is to see if we can put some kind of better care into place so that it takes some of the burden off of the family and And if it helps somebody down the road, if it doesn't help me, it will help somebody else.
Now, earlier today, I got a call from Kathy Deavy, Rose's daughter, saying her mother died at 7:40 this morning. In her final days alive, she was getting much more support from CCAC with her basic living needs. The family says they only wish that support had come much earlier.
Well, that is a tough story to see, a very difficult time for the family. And our condolences, obviously, for losing their mom today,
Yeah.
Rose. Simon, thanks for bringing us the story.
You're welcome.
Just ahead, imitation wasn't the highest form of flattery.